Thanks for the kind introduction, and it's a great honor to be here in front of everybody today, the Indian Women Network of the CII. So, as they introduced, I'm an endocrinologist at Apollo Hospital. That means a subject dealing with hormones. Specifically, the topic was given as hormones and diabetes. The reason being, although diabetes is one of the hormone-related disorders, diabetes is the most common amongst all the endocrine disorders. So the way I've designed the slides is that first I'll go through regarding diabetes, which is the most common amongst all the hormone-related disorders. And in the second half of the session, I'll focus on the other hormone-related problems, like, for example, the pituitary, adrenal, thyroid, etc. Having given the session here, talking to the elite audience, I've also included some of the slides, including some of the medical aspects, real-life case studies, which I hope you would be able to enjoy. So moving on from here, the first, what are hormones? Hormones are essentially chemical messengers that are produced in certain glands in our body called the endocrine glands. It used to be called the ductless glands, and get secreted into the bloodstream. These are tiny, tiny molecules which are invisible to naked eyes. But the interesting, unique aspects of these hormones are that it exerts the effect on almost every cell in our body. For example, if I give a comparative feature, if somebody presents with chest pain, often people understand that this could be the heart. If they present with breathing difficulty, they can understand this could be the lungs, which is the problem. Unlike those organ-oriented or organ-specific problems, these hormones exert their effects in every single tissue of the body. So often people present with very non-specific symptoms. The interesting thing that today in the world of endocrinology, we have got the treatment options for almost every endocrine problem that we diagnose. There are still that which are not diagnosed yet or unknown to us yet. But if you look at the role of hormones, they regulate even the very basic aspects of our life. What should be our sleep pattern? What is our appetite? The thirst mechanisms in our body? What should be our body temperature? Gender determination at birth? So on and so forth. If you look at the endocrine glands, there are a number of endocrine glands in our body, starting from the top, the pituitary gland, which is often rightly so called as the master gland in our body, because it controls various other glands and hormones in the body, like our thyroid, adrenal, testes, ovaries, etc., etc. When the master gland is not working properly, obviously the servants will not be able to do the job. There is a widespread catastrophe in the body. But let me start with the most common amongst these disorders, which is diabetes. As you know, the word insulin is well known to most of us. And this insulin is secreted from the endocrine gland in our abdomen called pancreas. And that too only from this portion, which is the tail end of the pancreas, which is where the insulin is secreted. So everybody knows that diabetes means high blood sugar. Glucose is the fuel for the body. When I say fuel for the body, it's almost like the petrol for our car, without which the car cannot run. Every single tissue, be it the brain or the heart or the lungs or kidney, every single tissue in our body needs this for it to function properly. So you can imagine that if there is not enough glucose to the tissues which are available, then almost every single organ in our body can dysfunction. What happens? The glucose comes from the food that we eat, to be more specific, particularly from the carbohydrate portion of the food. For the glucose to enter the blood, from the bloodstream into the tissue. So from the food enters from the gut into the bloodstream. From the bloodstream, for the glucose to enter into every single cell of our body, the hormone insulin is needed. And that's the role of insulin, which is, as we saw, is produced by the pancreas. Just looking at the historical perspective, if we think that diabetes is something which is a modern disease, which has been discovered very recently, this is slightly going back through to the history. Diabetes, the word means siphon. And mellitus, which was added on later, is literally translates into honey. This word diabetes was first coined in 150 AD by a Greek physician called Eretus. What he noticed was that he did not know this was due to high blood sugar, but what he noticed was that when people develop this disease, they just thin down like anything. And he described this as melting down of the flesh and limbs into the urine. The illness is chronic, but the patient does not survive long, for once the disease has broken out in full force, rapid consumption and death soon ensue. So that summarizes it all. Nowadays, what we take for granted that diabetes can be treated with this, with medicines, with insulin, with pumps. There's so many modern gadgets that are available. But going back through to the history, at that time, he described that these patients died because there was no treatment available. As I told you, the word mellitus was added on later by a professor from Oxford called Thomas Willis, and that literally translates to sweetness of urine. Now, if we think 150 AD, i.e. around 1,900 years is a long time since diabetes was diagnosed, I think we should go back further to look at what our ancient Indian knowledge was. 4,000 years ago, our forefathers described this as madhumeha, a Sanskrit word for diabetes mellitus, which literally translates to madhu meaning sweet and meha is urine. So the sweet urine, the description of diabetes mellitus was found 4,000 years ago. And it is just not they described or coined the term madhumeha, they even given a detailed description of what madhumeha entails, which is exactly what we see today from the description of diabetes mellitus. The symptoms are given both in the Sanskrit words which the Ayurveda describes and in English. And madhumeha was placed under a taxonomy called prameha. Prameha, pra meaning disorders, meha is urination. So madhumeha was classified as one of the 20 different disorders of urination. This is therefore not a very new disease as such. And again, going back through to the history, the ancient Indian textbook even give the descriptions of the complications when this madhumeha was not treated properly. They even went on to classify this diabetes into two different types, which is what the modern medicine also gives this as type 1 and type 2, which we will see very shortly. So it's not entirely a new disease, but of course in the modern world today we are seeing more and more of this disease for various reasons, which we will see shortly. The types of diabetes, as we saw, the first type is type 1, where there is complete lack of insulin in the body, and type 2, where there is insulin production, but it is either insufficient or inefficient. The other type is the gestational diabetes, which happens during pregnancy, and by definition, usually it goes away once the patient is delivered. There are other different types of rare diabetes too, which I have not included here. As I described, type 1 diabetes means there is no insulin in the body. Often the patients present very, very early on in life, even at the age of 6 months after being born or 1 year. Generally, they are under the age of 30 by the time they present. When we see a patient with type 1 diabetes, what is the risk for the children to develop this? So if the father has got type 1 diabetes, the child's risk is about 1 in 17. This is all approximate based on various studies which we have done. And when the mother has got type 1 diabetes, it depends on the mother's age at the time of conception. Younger the mother, greater the risk of the child developing diabetes in the future. When both the parents have diabetes, the risk is even higher. Type 2 diabetes is by far the most common form of diabetes. I would say almost 98% of the diabetes which we see in India today is all type 2 diabetes. And it's insufficient or inefficient insulin. When either of your parents have diagnosis of type 2 diabetes, and when they're diagnosed under the age of 50, then the child's risk is about 1 in 7. When the parent's age is beyond 50, then the child's risk is about 1 in 30, nearly halves. When both parents have got type 2 diabetes, the risk is almost 1 in 2. Gestational diabetes, as we saw, it's diabetes in pregnancy, usually goes away after the baby is born. It's a stressful period for the women where there is an extra demand placed on the body for insulin. Some women are able to meet this extra demand for insulin, some women are not able to, and hence they develop this diabetes during that time period. But it's a testing time where it shows that given under stressful situation, these women can develop diabetes in the future. So they are at a higher risk of diabetes. Men do not have an equivalent of pregnancy to at least know that they are at a higher risk of diabetes in the future. How big is the problem? no surprise, I'm sure everyone would have the same experience. Even within our country, if you ask a household of 4 people, at least 1 or 2 of them will have type 2 diabetes. So it runs in crores. If you look at the geographical differences, the developing countries do have a larger proportion of this type 2 diabetes and are projected to have much more in future in 2030 as the statistics stand now. The symptoms, I think most of us know these symptoms very well. It's essentially to do with excess urination, which causes excess thirst. Because there is no glucose going through to the cells in our body, people get tired. Again, because there is no fuel to the body, they lose weight. Numbness or tingling, often they present with burning sensation in the hands and feet. In men, it can present with erectile dysfunction, slow healing wounds, blurred vision, dry and itchy skin are some of the common symptoms, but the list is not exhaustive. Diagnosis, pretty easy nowadays. Even with a handheld machine, you can test a random sugar to check somebody's sugar is high. Often it involves fasting and post-meal blood sugars, where there are predefined criteria to say somebody has got diabetes or whether they are on the path of diabetes. When I say on the path, green being completely normal, red being diabetes, anything in between is impaired glucose tolerance, which means they are at a higher risk. Left like that, they will develop diabetes sooner rather than later. Is it a serious problem? Of course, because it's the fuel for every single tissue in our body. If it is not taken care of, if it is not controlled, many complications ensue, not immediately, but in the future. And most of the treatment for diabetes, treating the numbers, keeping the glucose under control, all these are oriented towards preventing these complications in the future. For if this happens in the future or happened in the future, then many of these complications are not reversible fully. The treatment aims are 2. 1, to keep the blood sugar in the normal range, and as I said, to avoid complications in the future. Type 1 diabetes, as we saw, it is a lack of insulin, so the treatment is giving back what is not there in the body, that is insulin. Of course, diet is going to be important, and physical activity adds on to it. Type 2 diabetes, the treatment varies depending on what the blood glucose levels are at the time of diagnosis. If somebody presents with a blood sugar which is marginally elevated, say around 200 and 220, then we don't start treatment immediately. There is no need to start treatment immediately as long as you know for sure that the person is going to be compliant with the dietary modifications and the physical activity. Later on in stage, it's a progressive disease. So even when people are controlled on medications, diet and lifestyle, they may start requiring insulin later on in life. Just brief look at about the dietary pattern which we generally advise. The diet really depends on who the person is, what the sugar levels are, what their physical activity is on a daily basis, if it's a white-collar job sitting in an office or a hard-working person on the road. So depends on all of these factors we advise. But in general, we generally advise a well-balanced diet which includes all components, which is the carbohydrate, protein, and fat, because often we see that people asking about no carbohydrate diet, which is not generally advised as such. It is not like a no complete ban on carbohydrates. They should have and could have carbohydrates. Generally, the distribution advised is about carbohydrates of 60%, fat and protein about 20%. And in comparison, if you see, most of the Indian diet today do have a carbohydrate about 80%, which is far more in excess than what is generally recommended. Of course, these are well known that avoiding sweet sugars, deep fried foods, fatty foods, pickles, etc. Generally, a tendency to go for a low fat milk, low fat spread, low fat oils, etc. Going for a healthy eating pattern of grilling, dry roasting, microwaving, etc. More vegetables, of course, limitless. Some of the fruits which are very sweet and high in calories, which pushes up your sugar very quickly, are on the right hand side. Some of the fruits which are generally acceptable for people with diabetes, which they can have in moderate amounts, are on the left hand side. Generally, the advice is to increase the fiber content of the food, which could be your pulses, oats, wholemeal cereals, wholemeal bread, wholemeal pasta, etc. And if you are in this part of the world, there are a number of different traditional varieties of rice which have a high fiber content, as opposed to the white polished rice which we use often today, which is very low in fiber and very high in calories, which pushes up the sugar very, very quickly. There are other rice varieties like the varagu and samai, which is in Tamil. These have a much higher fiber content, which does not push up the sugars very much. Or people might have heard about the brown rice and the red rice. Exercise, an integral second step in the management of diabetes, at least 30 minutes per day. If not in one stretch, at least break it up into 2 or 3 10 minutes in a day. Generally, try to combine this in your daily activity like walking and climbing stairs. A goal of 10,000 steps on your pedometer per day, or any of the other activities which you enjoy, would burn the calories, controlling your diabetes. Looking at the medications for diabetes. Before insulin was discovered in 1921 by Banting and Best from the Cambridge University, people used to die, and as we saw from the Greek physician's description, people used to die because of diabetes because of this reason. And now this is something which we take it for granted, that when you get diabetes, when the sugars are not under control, we go on to insulin. It's so easily accessible and available. Tablets were introduced much later in 1955, but right from the introduction until now, it's gone through a revolution, I should say. The way the insulin has been administered, the way insulin has been manufactured, the purity of the insulin, everything has changed completely, because as you may know, most of these insulin were initially prepared from the animal extracts. So all these impurities did not agree with the human body. They had multiple skin reactions. As we moved on to human insulin, which had far less complications. The way we administered insulin also changed. The needles become smaller, as we can see here, and thinner as well. And more recently, we started having this insulin pens, which exactly looks like a pen, and you can't even see the needle size here. It's so thin. And more recently, even more advanced, is that we have something called an insulin pump, which requires not you to inject every single day, 3 or 4 times every day. You just latch on this gadget to your body, and this tube can be changed once in every 3 days or so. And insulin is stored in the reservoir, which is slowly being pumped through this tube into the body as such. So lessening the number of pricks every day people used to have, and giving definitely a much more tighter control of blood sugars, because the way you administer insulin through the pump is very different, where you can control the blood sugars on an hour-to-hour basis by adjusting the insulin doses. So it's gone through a major revolution, and death is not something which happens now just due to diabetes alone, but often we see this because of the complications which arise due to diabetes when the sugars are not under control. And that's the main focus of treating all these people with diabetes, to keep the numbers under control, etc. So most of us know that it affects your eyes. When the high blood sugar can lead on to bleeding of the blood vessels in the eye, what we call as a retinal hemorrhage. The retina can get detached, and if this hemorrhage bleeding happens in single central spot, what we call as a macula, that is, if you imagine this circle here, right, and this is one single spot which is almost like a pinhead size, and that tiny spot is essential for us to look at the person in front of you, the slides which you are looking at. All the other peripheries are less important. So if you develop little tiny dots of hemorrhages here, it's not a great deal of problem. But somebody developing hemorrhages, the bleeding near to the central part, it's very vital. The next one bleed can just take away the vision completely. So blindness can ensue, and hence the need for annual examination with the dilated people. When we tell people often for eye examination, they think it is for testing for glasses, testing for vision. That's not the one which we are talking about. The complication due to diabetes happens behind the eyes, what we call as a retina, which is almost like the screen of your eye. So this has to be examined by a special equipment called the slit lamp, with the eyes being dilated, the pupils being dilated as such, without which we cannot say for sure. As I said, this is all about prevention. If we do notice a bleeding spot near the central vision, then that can be tackled with laser, and the blindness can be prevented. So consult a doctor. What are the warning signs? Blurry vision, seeing dark spots, flashing lights, rings around lights. So anything of concern in a patient with diabetes, they are advised to see their eye doctor. Heart care. The diabetes affects the heart in 2 ways. One is angina, which is blockage of blood flow to the heart. I think this is very well known to people. And the second is heart failure, where the heart is not able to pump enough blood to meet the body needs. So people start having backflow of this water, and people start getting ankle swelling, etc. To prevent heart problems, it's essentially to keep track of all the things which can lead on to heart problems, like your sugar, blood pressure, cholesterol, avoiding smoking, and limiting the alcohol intake. Kidneys are the other organs which can get affected, and yearly examination for urine protein and the blood creatinine, which is the marker of your kidney function, is vital. If you imagine the kidney being like a sieve with tiny holes in it, the role of kidney is to retain the products which are necessary for the body and filter through the ones which are not necessary through the sieve. With uncontrolled diabetes, what happens is the holes in the sieve can get bigger, and that's when people start having leakage of protein in the urine, which is what we test on an annual basis. This is a very, very early sign that something is going on wrong with the kidney due to diabetes. And this is a stage where we can arrest things from progressing further, developing a complete renal failure or kidney failure as such. So if you get a cloudy urine, bloody urine, burning sensation when you pass urine, incontinence, chills and fever, back pain, which is all indicative of a urinary infection, it's important that you consult the doctor. Foot is another vital organ which gets affected due to two reasons. One, the nerves which can get affected. As I said, glucose is the fuel for every single tissue, including for the nerves. So when the nerves get affected, there is no sense in the foot. They do not know where they are stepping onto. They can get injured very easily, and the injuries can go easily unnoticed. It is a very slow process, but patient does not realize about the damage because they do not have the sensation as such. So yearly examination of the nerves and blood vessels, that is the blood flow, is important. Home glucose testing, it's come as a boon nowadays that people can test the blood sugars within 10 seconds at their home, which helps for them to understand what sort of diet affects their blood sugars, and it's helpful for them to achieve the treatment goals. To summarize the first half of my talk, diabetes is the most common among the non-infectious diseases. The three cornerstones of treatment, we cannot go just with medications. Often I tell my patient that the first step in the management is your diet, the second step is your physical activity, and then comes your medications. And if the blood glucose is kept under control, the complications can be prevented in the future. So moving on from here to the other endocrine systems, other hormones, I start with the pituitary, which is the master gland. I've represented here the pituitary, which is in the brain, which is roughly the size of the nail in your little finger. So it's so tiny, but it is so important. When this tiny structure does not function well, almost the entire body system collapses. And rightly so, it is called the master gland because it controls all the other hormones in the body. This black and white photograph describes a person with growth hormone excess, growth hormone being one of the important hormones which is secreted from the pituitary gland. As the name indicates, growth hormone, it is important for a person to grow. So a child who is born with 150, 160 centimeters growing to 6 feet, the essence of this is this growth hormone. What happens when it is not working properly? This is a slide which shows where this person has got growth hormone excess. That means he keeps growing. When this hormone problem starts well before they achieve the age of 18 or 19, when the long bone stops growing, they keep growing. So the old name used to be gigantism for these people because they grow like a giant. And in comparison, that's a normal height of the person there. When the growth hormone excess happens, when the long bones have stopped growing, they do not have the potential to grow vertically, height-wise. But the growth hormone exerts its effect in other ways. So comparison here, this is the size of the hand for a normal person, and because they do not grow in height, the hand size enlarges significantly. It keeps enlarging. That's the size of the tongue of a person with a growth hormone excess. The condition is called acromegaly, and you can see that the tongue almost fills their mouth. The bones also grow in the opposite direction because they can't grow this way. It grows this way, and they get something called prognathism, which is essentially a protruding jaw. You can see this is very prominent, there's a prominent forehead. So many of the bones grow in the direction where it should not, and causing all these deformities which we see here in this person. The opposite of which is the growth hormone deficiency. As the name indicates, when the growth hormone is not there, the person is not able to grow. So they are of short stature. This is an example of this family. three brothers where this person has got a normal growth hormone level, whereas these two people have a growth hormone deficiency. You can see that in proportion, they look very similar as their brother, except for the height as such. Again, when the growth hormone deficiency happens in childhood, they are not able to grow in height. Previously, the awareness of this condition was not there. The testing facilities were not there. The treatment was not available. But nowadays, all of these are available in India as well, where you can easily do a blood test to diagnose this condition, give an injection to treat this condition, and you can make the child grow to a normal height. When they present late, as I said, when the bones fuse and when the bones stop growing, if they present beyond the age of 15 or 16, when the bones have stopped growing, and if they got growth hormone deficiency, then it is very difficult to achieve any great height as such. When the same hormone deficiency happens beyond the age of 18, when the bones are fused, the symptoms are different. The patient presents with very non-specific symptoms like tiredness, lethargy, unable to carry on their work on a daily basis, a protruding abdomen, and they develop a tendency towards diabetes, etc. As I told you earlier on, I've included some real-life case scenarios who I've seen in the past year or so. So this was a 54-year-old female who presented to me. She's from Chennai. She originally presented to the neurologist, the brain specialist, with 1 year history of headaches, worsening over a period of 1 month prior to she presented to the neurologist. They did a CT scan which showed a pituitary tumor and hence was referred to me. But taking a detailed history, it was very interesting to see that she told me that her periods stopped after the birth of her first child, which was 26 years ago. Right at the age of 28, her periods stopped. She was seen by some of the doctors nearby area, but then she took that this is it. She had it, and then she did not investigate or treat this further as such. But later on in life, at the age of 54, she now presented because of her headaches, not because of the periods. This is the scan of that person. For comparison, I've given the pituitary scan of a normal person on your left-hand panel and that of my patient on the right-hand side. And the yellow arrow indicates towards the pituitary gland, which is normally of this size. As I told you, this is the size of the nail in your little finger. That's how it should be. And you can see how big is her pituitary, which has grown over a period of 26 years maybe. Very importantly, above the pituitary gland, this white structure here is the nerve to the vision. So the reason why we are able to see is because not just eyes, but the nerves that carry the signal from the eyes to the brain. And that sits right on top of the pituitary gland. If you can imagine, if this pituitary gland grows and compresses this nerve, obviously the vision can get affected. People often don't notice because it's the field of vision which gets affected. What I mean by that is this. Again, the normal on the left side, our patient on the right side. This is how it should look like. When you're seeing, this is a field vision testing where we are testing whether the person is able to see the entire field in front of them. And this is how it should look like. What this indicates is this dark portion, that is 1 quadrant of her vision she is not able to see, for the same reason what I mentioned in the previous slide, where the pituitary is compressing the nerve to the vision. Her prolactin hormone, which is another hormone, we saw the growth hormone earlier. Prolactin is the other hormone which gets secreted from the pituitary gland. Her hormone level was exponentially high. What should be around 20 or 25 was 11,800 in her case, which was the reason why she stopped having periods, which was the reason why she was having persistent headaches, and there were many other symptoms which she presented, which I have not illustrated here. But this is one of the conditions which can be treated just with tablets. In fact, the next slide, what I'm showing here is, I started on a tablet form of treatment for this prolactin secreting tumor. That's her field of vision, which, as I said, 1 quadrant of the vision she was not able to see, hence it was dark. And this was the vision 1 month later, which is almost back to normal, indicating the pituitary tumors has started shrinking. And that was not such a big tumor. If you look at the next slide here, this is another patient who presented, this is a male patient who presented to me with headaches and a lot of other symptoms. And you can see this entire white bit, which looks like a cauliflower, is the large pituitary tumor which he had in his head. And again, with the tablet treatment, this is the effect 1 month later. You can see the size of shrinkage. So not all of these pituitary tumors do need a treatment, do need a surgery, but It can be controlled with tablets as well. There are certain groups of pituitary tumors which often require surgery for a complete cure. This is essentially to highlight that these pituitary tumors can present with very non-specific symptoms like what we saw from our first patient. It's just being aware that such things exist and the treatment being available is what is important, to pick these on early, which would have avoided the suffering for about 26 years what this lady went through. The next gland is called the adrenal gland, and roughly situated here, that's your kidney, and what we are seeing on top of the kidney as a yellow gland is called the adrenal gland. There are two adrenal glands on either side. It secretes three different hormones. One hormone is called the adrenaline, which most of us would have heard, otherwise called the hormone of fright. And this is the hormone which helps us to cope with acute stressful situation, like a frightful situation. It has got a lot of other roles like maintaining the blood pressure. The second hormone is called the cortisol, often being described as the stress hormone. It helps us to cope with chronic stress. It also regulates the metabolism of carbohydrate, protein and fat in our body. The third hormone is called aldosterone. It regulates the blood pressure and regulates the salt levels in the blood. So just again by illustrating what these hormones can do to you, I'm putting forward another second patient who presented to me like 4 months ago. This was a 12-year-old girl who came from Uttar Pradesh, presented to us with a 1-year history of excessive weight gain, lack of increase in height, which was expected for her age, especially in the 1 year prior to her presentation, she almost stopped growing height-wise. Lack of concentration. She used to be a very studious student in her school, and the parents started noticing poor performance at school, tiredness, and her periods stopped abruptly. On examination, she had a facial puffiness, rounded face. She was short for her age. She had very abnormal stretch marks, which what I've shown here. Again, the left-hand panel shows the normal white stretch mark which we see due to exercise or increase in weight, etc. And this is my patient, the 12-year-old girl who had this abnormal purplish stretch marks which is white. This is not normal. This is not just the weight increase which is causing this. This is the hormone-related problem which causes skin thinning. Essentially, what this girl had was excess of this hormone called cortisol. It's almost 3 times the upper limits of the normal. And the CT scan showed a 3-centimeter right adrenal tumor. And this condition is called Cushing syndrome, named after the professor who diagnosed this condition called Cushing's. We commenced on the drugs to nullify the action of this excess thyroid hormone, and one of my colleagues operated on her to remove the right adrenal gland by surgery, and she recovered fully. Now, the importance of this is 50 years ago when Professor Cushing's described this condition of excess cortisol, the death rate was about 50% due to various reasons, heart failure, blood pressure, diabetes, etc. But nowadays we do have treatment and we can achieve a cure with the combination of medicines and surgery. The second hormone is the adrenaline hormone, which in excess can cause palpitations, which drives the heart, excessive sweating, headaches, and the classical symptom which they describe is a feeling of impending doom. Again, untreated, this is a fatal condition, and death is usually due to the abnormal heart rhythm. The adrenaline drives the heart and the heart rhythm becomes very abnormal. Again, to illustrate this with a case study, a 76-year-old female who presented with acute breathlessness, 3-year history of palpitations and sweating, abdominal pain. She was agitated at presentation. Her heart rate was quite fast, what should be a 60 or 70. Her heart was running at 120, quite high blood pressure. The breathing rate was increased. There was fluid in the lungs, and she was quite tender in her abdomen. Again, the normal chest X-ray on the left side. This is our patient. What it should be looking like this, which is a black portion. You can see there is a white spot here, which is all due to excess fluid in her lungs. Also, her heart is quite enlarged. This was all the result of this hormone called adrenaline. Again, as opposed to a level of 20, her level was like 2,300, 2,400. So this excess adrenaline hormone was causing the problem. That's the CT scan of the abdomen. The adrenal gland is normally only this big in size, which is almost like a thin strip, as you can see the yellow arrow which points towards it. And in our patient, the adrenal has enlarged to this size, which is the large adrenal tumor which she had, which was secreting a lot of adrenaline hormone. Again, we gave the drugs to block the action of the hormone, which is vital. Without blocking the action of the hormone, if we take this patient for surgery, most people do die because of this excess hormone action on the heart. Finally, our patient after the surgery recovered fully. The other important endocrine system in our body is the testes and the ovaries. As you know, these are the female and male counterparts, the ovaries being present inside the abdomen and testes outside. The male-female hormones are so vital that they determine the gender at the time we are born. It determines whether we are male or female. The changes which happen during adolescence, the bodily changes and the emotional changes are all determined by these male and female hormones. Fertility, of course, is under the control of these male and female hormones, but apart from these functions, it also helps with the bone strength. As we commonly see, after menopause, women often are put on these calcium tablets to strengthen their bone, because without the female hormones, the bones tend to get thinner, osteoporosis. This was a 15-year-old female, again from Chennai, referred by a gynecologist who saw her locally because the child did not develop periods, did not start having a period, and there was lack of breast development. The parents were not related, non-consanguineous marriage. She had one younger sister who was 10 years old. When we measured the hormones, the female sex hormones were completely undetectable. And obviously, when these hormones are undetectable, because these female hormones come out of the ovaries, the next important step in the investigation is whether they do have an ovary or not. And that's the MRI of the patient. Again, the normal being on the left side, the patient's imaging being on the right side. What I've highlighted here is the uterus here, and to the other side will be the ovary. As the arrow points out here, the uterus should be here in this position, which is completely lacking. That's the urinary bladder, that's the uterus, and this girl did not have the uterus nor the ovaries, and hence there was no female sex hormones which was detectable. So in the absence of the female sex hormone, there was no secondary characteristics which is expected at the age of 12 or 13, including the puberty and lack of breast development, etc. Again, as I said, gender determination, whether a baby is born as a male or a female, and the genitalia, how it develops, it's all under the control of the sex hormones. So when the male hormone or the female hormone is not functioning properly, which can go wrong at multiple levels during the process of birth, during the process of childbirth. So it can be an enzyme defect, it can be a hormone defect, or it can be the target where the hormone acts. So multiple sites can go wrong in this process. The absence of this, as you can see from this baby, you can neither say this baby is a male or a female. And we do have a number of people who are loitering around the community because of the lack of awareness of these conditions, which can be investigated and treated provided they are picked up early. Polycystic ovaries is something which is again related to the ovaries, which is the female hormone, which is nowadays seen more commonly. We do not know much about the cause of this condition, but often what we know is this is often seen in overweight individuals. They present with menstrual irregularities, acne, excess facial hair growth. The exact cause is not known, but excess weight seems to be one of the important factors which drive these symptoms. There can be associated multiple other symptoms, including insulin resistance, which is a risk factor for diabetes. And these marks which we see, sometimes people might have noticed there's a black pigmentation in their neck or underneath the armpit. This is called acanthosis in technical terms. Otherwise, these are signs of insulin resistance. That means your pancreas is working hard to keep the sugars under control, and they are at a higher risk of developing diabetes in the future. Polycystic ovaries can also impair the fertility. One of the important, it cannot be overstressed, but it's such an important vital part of the treatment is weight loss. And one good example would be that a person who is overweight, if they lose their weight by just a meager 5%, they improve the chances of fertility by about 25%. There are also drugs to regularize the periods, to induce ovulation when they present with infertility, or to improve their excess hair growth and acne, which are the other symptoms of polycystic ovaries. This I included without knowing that there are not going to be many male audiences. But anyway, underactive male hormone do have this consequences like decreased or lack of libido, erectile dysfunction, lack of energy and infertility. Again, treatments are available with hormone replacement or induction of fertility with hormones. The last is the thyroid gland, which is a well-known term nowadays amongst, at least in the urban areas. The functions is multitude. Its actions is almost in every single tissue. It is essential for the long bone growth. It maintains the basal metabolic rate and regulates the metabolism in many ways. Again, this is not an exhaustive list. I've just highlighted the list of symptoms which we often see, or people often recognize these being related to thyroid, like weight gain, depression, menstrual irregularities, infertility, etc. But there are a number of other symptoms which debilitates the patient with underactive thyroid. And this is a typical photograph of a person who presents with a significantly low level of thyroid hormone. When the lack of thyroid hormone develops in children, they present with other features like short stature, delay in the eruption of teeth, muscle weakness, either early or delayed puberty, and even the mental development. The cognitive function can be affected. This is a child who presented with this thyroid hormone underactivity and being short stature and not up to the mark cognitive development. This used to be a very common condition in India 10-15 years ago, where people developed a large goiter or a thyroid swelling due to iodine deficiency. Since our government embarked on an ambitious iodine repletion program for the past 15 years, this has become much less common nowadays. And what we see nowadays as a cause of underactive thyroid is what we call as an immune-mediated or an autoimmune condition. Generally, the risk is higher for women when they have a family member who has already got a thyroid problem, or in the presence of another immune-mediated disease. Overactive thyroid, exactly the opposite to what we saw. So they present with weight loss, palpitation, emotional fluctuation, muscle aches, again with menstrual irregularities and infertility. They do present with eye symptoms because the same process which affects the thyroid can also affect the eyes. And this is a typical starry eye which we see in overactive thyroid individuals. And this woman has got overactive thyroid. You can see a bulge in the neck, which is the thyroid swelling, and the typical starry eye due to the thyroid problem. The other important presentation people present with is a nodule, a lump in the thyroid gland. It's very common, often incidentally discovered. They get a scan for some other reason, and these tiny lumps are diagnosed incidentally. These are often benign, not cancerous. And the investigations are essentially to make sure that the thyroid is functioning properly and to rule out that there is nothing sinister underlying, which we do by ultrasound or, if required, by an FNAC, which is essentially a needle biopsy. Once diagnosed, depending on the size, depending on the characteristics of this swelling, follow-up is necessary to make sure that these are not increasing in size and these are not turning into anything sinister. But otherwise, as I said, majority of these thyroid nodules or thyroid swellings are benign in nature anyway. This is another uncommon hormone condition which we see. Here on your left-hand panel, you see a child who is 3-year-old, and as a 3-year-old, he is weighing about 42 kilograms. And after treatment for this hormone condition, at the age of 7, the weight is 32 kilograms. And this is a hormone called leptin. And there are only about 500 known cases of leptin deficiency who have been treated with this leptin hormone. So again, the awareness about this condition, lack of awareness means this child will be putting on weight like anything. They may present with a weight of 120 kilograms as young as a 6 or 7-year-old, but associated morbidities, associated problems are multitude. Just to summarize, hormones influence the function of our body from head to toe, and also the mind. They often present in very non-specific manner because this is not something which presents with symptoms only in that portion. That means if the person develops a thyroid problem, the symptoms are not just limited to the thyroid gland alone, that is the neck alone, but it is from top to toe. And awareness about these hormone problems is poor in India, hence often can get wrongly diagnosed or diagnosed too late. And nowadays, as we know, India has the big health tourism, has got a big health tourism where people from abroad are coming here for treatment. So most of these hormonal disorders can be diagnosed correctly, and such investigatory facilities are available. The treatment facilities are available in specialized centers. Treatment do exist for these hormonal disorders which can avoid long-term problems in these people. And thank you one and all for this great opportunity.
Thank you, Doctor. I request the participants to write down the questions, if any. Now the session is open for Q&A.
Is that still recording?
Participants, please type down the questions in the dialog box.
I'm just answering by just reading out the question. That's okay, I can read it. Does the malfunction? She's got three questions. I can probably combine one after the other. Maybe I'll start with this one. Okay, the Q&A session. There is a question from Florence McDonald. The first question says, does the malfunctioning of pituitary gland bring on neuro problems? I'm not exactly sure what exactly do you mean by neuro problem, but as we saw from the presentation, the pituitary gland dysfunction can cause a lot of problems. Say, for example, a person who has got underactive thyroid due to the pituitary gland can present with memory disturbances to the extent they cannot remember their next kith and kin. So that is often, because it's a non-specific symptom, they can present to the neurologist with memory problems. As such, when I say neuro problem, for example, the other side of the neuro problems people present with, like limb weakness, those sort of symptoms generally do not happen with pituitary gland. But the other thing which can happen, say the pituitary gland, as I showed you in the picture, is quite near to vital structures. More importantly, there are vital important nerves which control the eye movements. If there is a pituitary tumor which is expanding, enlarging, this can compress on the nerves to the eyes, which controls the eye movement. It can impair the field of vision. That means they cannot see the entire face in front of their eyes. Or it can affect the eye movement so that to the extent where a person cannot see side to side. So in that sense, it can cause neurological symptoms, or in that sense, the symptoms can overlap with neurological problems. Another question from Mrs. Florence McDonald, how do you assess metabolism? This is not something which we routinely do in and day out practice, because often most of these conditions can be diagnosed just by simple blood tests and scans. But we have done it, and I have done it for research purposes. Say, for example, in thyroid problem, as I told you, that's one of the important hormones which control the metabolic functions in our body. The underactive thyroid hormone reduces your metabolism. The overactive thyroid hormone increases your metabolism. There are ways and methods where we can exactly measure what is the basal metabolic rate. That is the thermoregulation, the regulation of your body's temperature, how fast your metabolism is happening, how fast your calories are being burnt. All of these things can be measured accurately, but we do not do this on a routine clinical setting. Often this is done on a research setting, in a research setting. Another question from Pravina, is there any permanent solution for polycystic ovaries? In a sense, yes. When I say in a sense, as I told you, the main important driver seems to be the excess weight, and people who do lose weight or bring down the weight back to what they should be, often the symptoms resolve or improve significantly where it becomes insignificant. The other thing we do notice is people with polycystic ovaries, when they do get pregnant, and after delivery, most of these symptoms do resolve as such. But in between this delivery, or in between the time they present up until the pregnancy, they do need support in terms of medications to regulate their periods, to regulate their fertility, restore their fertility as such. There is another question from Ms. Sudha Rani. Once diagnosed thyroid, is it for lifelong medication or it gets reversed after a few years? This very much depends on what is the cause for the thyroid dysfunction. or I presume you mean the underactive thyroid, which is the most common amongst all the thyroid disease which we see. When a patient presents with underactive thyroid, whether they need lifelong replacement or not depends on why they develop this underactive thyroid. An example, a person completely well, completely having a normal thyroid function, develops a mild subtle thyroid abnormality or an underactive thyroid during pregnancy. As I told you before, with diabetes, pregnancy is a time of increased demand on the body, and there is an increased demand for thyroid hormone as well, because the mother has to provide thyroid hormone for the baby at least up until the 15 weeks of pregnancy, where the thyroid hormone slowly starts functioning in the baby. So at least up until that time period, there is an increased demand on the mother's body for increased production of thyroid hormone. So if this person develops a mild thyroid dysfunction during pregnancy, we do put them on thyroid hormone treatment, and once the baby is delivered, often this gets back to normal because there is no more an extra demand on the body, and we stop the thyroid hormone replacement. If a person develops this due to iodine deficiency, it is quite easy. You replace with thyroid hormone, but you replace the iodine as well. Once they are iodine replete, usually the thyroid hormone gets back to normal. They do not need a lifelong replacement. But the most common reason what we see today is the autoimmune thyroid dysfunction, meaning the immune-mediated destruction or immune-mediated way in which the thyroid gets affected. This often is a lifelong replacement. This often requires a lifelong replacement for thyroid hormone, because the thyroid is not functioning. Often the story is that initially when they get diagnosed with the thyroid problem, they are put on a very small dose of thyroid hormone. As years progress, they start requiring bit more, and bit more. That means initially when they get diagnosed, only part of the thyroid gland was not functioning. Then later on, slowly the thyroid starts giving up its job, and then we have to replace more and more of this thyroid hormone until it reaches a plateau level, and beyond which often they require this as a lifelong replacement. The next question is from Pravina. To regulate hormones, do we need to follow any particular diet pattern? This really depends on what hormone we are looking at. For thyroid, for example, there is nothing specific. In a country where there is, which is iodine replete, often it is not required for you to follow any specific diet, because most of our salt today is iodized salt. If you are asking about insulin hormone, yes, definitely. Especially with the modern lifestyle, with sedentary lifestyle and the fast foods fastly coming up into the market, our diet pattern is being changing very quickly. Definitely that needs a diet pattern which is the healthy lifestyle which we discussed earlier on. But apart from these, the other problems which we discussed, the adrenals, the pituitary, they do not require any specific diet pattern to prevent the diseases as such. I think pretty much the next question is also on the same lines from Pravina, which says, do our food habits will result any hormone problems? Which is almost the same what we discussed early on. There is another question from in fluctuation in dopamine is said to bring down the energy levels, and what is the role of master gland in this? So dopamine is actually, we saw a patient earlier on who presented with 26 years, the periods having stopped, who had this hormone called prolactin, which was very high. The role of dopamine in the pituitary gland is essentially to keep this prolactin hormone under control. Apart from this, the effect on the pituitary gland, the dopamine also has got a number of other functions in the brain itself, not exactly in the glandular tissue, not exactly in the pituitary gland, but in the brain as such. So there is a system in the brain called a mesolimbic system, which is to do with our emotions on a daily basis. And this is under the control of dopamine. Somebody feeling very joyful, somebody feeling very moody, somebody feeling very depressed, that becoming their nature. Many of these are under the control of this tiny molecule called dopamine. And the fluctuation of this can happen for various reasons. And this can determine the emotional levels, emotions in our body. And especially when the question reads in dopamine is said to bring down the energy levels. As I said, if somebody is going to feel depressed and mind is the driver for the body, and obviously that person is going to feel drained out completely. And in that sense, yes, dopamine can affect. The next question is from Sudha Rani. Which drug is safe for diabetes in the long run? I would say horses for courses. So it's not like every horse is suitable for every course. It depends on the person. It depends on what other conditions the person has got. I'll start from the very basic, like the metformin, which is one of the common medicines which we use for people with diabetes, which has been time tested for nearly 60 years. This can give rise to gastrointestinal side effects, like, for example, a burning sensation in the stomach. But it is not common. Not everybody develops this symptom. Usually it settles even in the people who start having the symptoms. In 1 or 2 weeks, these symptoms do settle. But in the long run, I presume when the question says which drug is safe for diabetes in the long run, I presume you're asking whether this can affect any of the bodily organs. Certainly not. As far as we know, both the major group of drugs which are used in diabetes, called the sulfonylureas and the metformin, have been in use from 1950s, and it has not been shown to affect the organs, the body in the long run in any major way. It can cause short-term symptoms. As I said, metformin can cause this gastrointestinal side effect, which usually settles after some time. But in some people, if it doesn't agree, we have to switch over to a different class of medicine as such. It's mainly, I mean, to put it another way, it's mainly the high glucose which affects the bodily organs rather than the drugs as such. The next question from Sri Nitya: can the type 2 diabetes, can the tablets be stopped at any stage, or once detected we should have the tablets lifelong? It really depends on pretty much what you do in life after being diagnosed with diabetes. It can depend on the person. A person who is weighing 85 kilogram at the age of say 26, who develops type 2 diabetes, decides to do this with diet and lifestyle, loses 10-15 kilograms over the period of next 5 years, goes back to a very healthy lifestyle and very healthy weight. This person may not need tablets for next 5-10 years at all as such. They can maintain just with diet and lifestyle measures. A person who is not very willing to engage with these sort of activities, then obviously we start the tablets. And usually in this situation, the course is that we start on one tablet, the sugars after a few years increases slightly, then the second and the third tablet, it goes on so forth and so forth. And thank you for some of the feedbacks you have given me.
Participants, if you have any questions, please do type it down. Ms. Pravina, it's an incomplete question. Can you please type down the complete question that you wanted to ask?
So the next question from Pravina is, will type 1 diabetes get affected due to hormonal imbalance? That's a very good question. What it means, I think what she means is, a person who develops type 1 diabetes, can they get affected due to other hormonal disorders? The answer is definitely yes. As I was explaining earlier on, a person who is prone for one type of immune-mediated disease, it could be an immune-mediated diabetes, which is the type 1 diabetes. It could be an immune-mediated thyroid problem, which is what we call as the autoimmune thyroid disorder, or be it any other immune-mediated disorder. Once they develop one or two of these immune-mediated problems, they are more prone for the second and the third and the fourth. In fact, these are grouped into a disorder called polyglandular autoimmune syndrome. So poly means many, glandular is the glands, endocrine glands, autoimmune, as I said, immune-mediated syndrome. So these group of people tend to develop this one after the other. So they develop the type 1 diabetes. Second, they develop adrenal insufficiency, the hormone which we saw, the cortisol insufficiency. They develop an anemia due to vitamin B12 deficiency. They develop something called vitiligo, which is the white patches in the skin which you see. So many of these diseases, the immune-mediated diseases, are interconnected to each other. Once they develop one or the other, they are more prone for development of the second or the third or the fourth.
Thank you, doctor. Thank you so much for giving us a complete insight of hormones and diabetes and issues that we face due to that. I hope the participants had a complete insight of the topic, and any more questions or queries, it can be posted in the IWIN website. The questions will be answered by the doctor, and thank you so much, Dr. N.K. Narayanan, for spending your time, and looking forward to have more sessions with you and with Apollo Hospitals. Thank you so much.
Thank you, one and all.